in your small books, lesson 6 quiz. We'll go over that. Vancomycin, number 1. Vancomycin is used in therapeutic drug monitoring. That's a bad question. Vancomycin isn't used in the therapeutic drug monitoring. Vancomycin is therapeutically monitored. It's a very powerful antibiotic that can cause liver damage in elevated doses, so it is monitored. It's not used in it, but it is monitored, so it's a bad question. Number 2, list 2 vascular access devices. Well, they're in your book. 4 or 5 mentioned a heparin lock, which is typically inserted into a peripheral vein, very often called catheter, or just simply an IV. If it's flushed with heparin to prevent clotting in the IV catheter, it's called a heparin lock. Central venous catheter, which is a catheter, or a central venous line, is a catheter inserted into the central venous system as opposed to the peripheral system. Could be a PICC line, peripherally inserted central catheter. It's inserted typically into the peripheral vein, and with a long catheter that then comes up into the central venous system. It's called a PICC line, peripherally inserted central catheter. And then there's others in your book. You can look at those. The test is ordered on a patient with a heparin lock. What test should be ordered and what tube should be drawn? Well, if a patient has a heparin lock, that's simply an IV catheter being flushed with heparin. Heparin is an anticoagulant, so you'd have to run an anticoagulant or a coagulation test. So that tells you blue tube, and the particular test would be activated partial prothrombin time, APTT. Number 4, at which of the following ranges would you discontinue the glucose tolerance test? The book tells you 140 to 160. If you're doing that initial blood glucose level and the patient has been already fasting for 10 to 12 hours and they're reading 140 to 160 when normal is 70 to 120, then they're already very high, which is unexpected because they should be very low after fasting for 10 to 12 hours. So if they have a level of 140 to 160, you would notify the nurse, who will then probably notify the doctor, and they'll decide whether to continue with the test. Explain the procedure for a bleeding time test. Bleeding time is very simple. Could also be called a clotting time test. And typically what you would do is with an alcohol swab, clean an area with a concentric cleaning motion on the forearm using a standard lancet, which is 5 millimeters tall. It's going to cause a puncture wound that is 5 millimeters tall, 1 millimeter deep, 1 millimeter wide. You puncture the arm, and then when you get a droplet of blood, you stick it onto a piece of calibrated paper. Typically, it takes 3 seconds to be at the 3-second mark. And then when the next droplet of blood forms, if it's at 5 seconds, you touch it at the 5-second mark and continue until you quit bleeding. And those papers are typically round like a coffee filter. They're just calibrated with time as you go around the paper, and you touch and absorb the droplet of blood from the arm at the appropriate time. And when it quits bleeding, that tells you the bleeding time, which also tells you coagulation time. It's a very simple test. Allen's test should be performed before all routine venipuncture. Well, that is not true, because you don't do it before venipunctures, you do it before arterial punctures, and you have to have special training to do that. And in your textbook, page 102, is the proper description of how to do the Allen's test. It is not described properly in this book. You want to see it described page 201 in this book. Okay. Number 7, explain the following. Bacteremia is the presence of bacteria in the blood due to some kind of a disease process. Disease process could be a bed sore. We have an open bed sore, becomes contaminated with bacteria. That bacteria finds its way into the blood. So that's bacteremia. Septicemia is the presence of introduced bacteria. So that would be from a phlebotomist, a nurse, a doctor doing a procedure on the patient, not properly cleaning, contaminating the equipment, contaminating the site, and introducing bacteria into a patient. So basically bacteremia is bacteria introduced into the blood by a disease process. Septicemia is bacteria introduced otherwise, typically by a healthcare provider. 2-hour postprandial sugar. Postprandial simply means after eating. So 2 hours after taking a standardized dose of glucola, which is a carbohydrate drink, typically 150 grams. 2 hours after that dose and after fasting for 8 to 10 hours, then the blood sugar is taken. We would expect 2 hours after that glucola dosing that the blood sugar would be back to normal, 70 to 120. If it isn't, well, then that tells the doctor something about how the glucose and clearance system, how the insulin and glucose clearing system in the body is functioning. Timed interval is any interval that is timed. You could think of that in the previous explanation of the bleeding time test. You're taking blood droplets at timed intervals. It could be any test that involves a timed interval, and we'll talk about that a little bit more when we talk about collecting blood cultures. Number 8, the standard amount of time required for fasting for a glucose tolerance is A, 10 to 12 hours. Typically, glucose specific tests, doctors will very often order 10 to 12 hours of fasting instead of the standard 8 to 10. Number 9, the PKU test, phenylketonuria test, must be performed in most states within, you don't really have a good answer there. The answer should be 24 to 72 hours. These are typically performed without parental permission because each state allows that. And read up about the PKU. It's a very important test for young children to prevent brain damage, or to put it a better way, to ensure proper brain maturation. How about that? Explain how you perform a blood culture. Blood cultures are collected in 2 sets of 2 tubes. You have an anaerobic and an aerobic tube. The aerobic tube will have a blue top, anaerobic will have a lavender top. You clean the site that is going to be punctured, typically with chlorhexidine. You allow that to dry. You clean the top of the bottles once you crack the metal tab off of it with chlorhexidine. You draw the blood in a standard fashion, and that blood is then either injected into the tubes, or if you have the proper tube holder, you can use the large 10 cc tube bottle, I should say, and draw it directly from the vein. Chlorhexidine is most often used as the cleanser on the arm because iodine, which used to be used a lot, is very often produces an allergic reaction in people. People who are allergic to shellfish shouldn't have contact with iodine, so iodine's kind of falling out of favor and chlorhexidine is being used. And you just follow your typical blood drawing procedures. You're just drawing in two sets of two tubes or bottles. A blue 10 cc bottle and a lavender 10 cc bottle. The blue one always goes first, and then you follow with the lavender. Then you wait a timed period. Depends on the protocol in the facility. Typically it's 15 to 30 minutes. And then you repeat the procedure. And you do that in a different arm, a different location. The reason you do two sets is you want to be sure that all of the results for both sets agree. If they don't, then you probably contaminated, because the two samples coming from the same body at an interval of 15 to 30 minutes should show the same results. If they don't, then it has to be repeated. That's a timed interval. The 15 to 30 minutes between drawing the two tubes, is a timed interval. All right, excuse me, these allergies are killing me today. Number 11, the tube of choice for the glucose tolerance test is a gray tube. Glucose tolerance test is a glucose specific test, so it's drawn in a gray tube. Number 12, the bleeding time test is used to test platelet function. That's true. Platelet aggregation is your first clotting function to occur in the body. And remember, the bleeding time test is a simple little puncture on the arm, 1 millimeter by 1 millimeter by 5 millimeters, and then you time how long it takes for the person to quit bleeding by absorbing the droplet of blood on an absorbent paper with timed intervals on that paper. Number 13, describe a 5-hour glucose tolerance test. 5-hour glucose tolerance test, GTT as it's referred to. You would start 3 days prior, and the patient would take a 150 gram dose of glucola per day for 3 days. It's very sweet, very nauseating to a lot of people, but they take the 150 grams per day to get the body accustomed to the high glucose levels and to ensure that you'll have maximum secretion of insulin into the body. So you're kind of priming that insulin pump to take down those high levels of sugar. And then the day of, after a 10 to 12 hour fast, prior to the beginning of the test, the lab tech will take a blood and urine sample as a baseline. If that baseline is 140 to 160 or higher, then you would stop the test and get further direction from the nurse or from the doctor, because already the levels are very high and you've been fasting for 10 to 12 hours. So that would indicate something to the physician, and they'll then decide whether they're going to move along with the test or to stop. At 0 hour then, the patient would take 100 grams of glucola. Then at a 1/2 hour timed interval, blood and urine are drawn. 1 hour, blood and urine are drawn, and so forth. 2 hours, 3 hours, 4 hours, 5 hours, blood and urine drawn and collected in gray top tubes, because this is a glucose specific test. And then looking at those levels across 4 hours can tell the physician how the insulin production and the glucose clearance from your body is functioning, and then they can go on from there to plan therapy or to plan further testing. And I believe maybe that's it. Yeah. So you got those 13 questions. Refer to your books, please. Remember, read your book cover to cover, answering all of your quizzes in the book, and 3 times. You got to read that book 3 times if you plan on taking the national exam. Don't want to scare you. It is a difficult exam, but it's only difficult if you haven't prepared. All right, guys, that's it. Thank you very much.